but it requires insulin, but on the later stage of it. But basically, diabetes is actually not caused by taking too much sugary food. No. But when diabetes has occurred, we will now avoid taking sugary food. Yes, there are some sensitizers that might sensitize insulin to produce too much. Those are actually appreciated. Viral infection, autoimmune disease, those are the things that can cause somebody to have type 1 diabetes. And type 2 diabetes again runs in family. There are some things we can do to reduce insulin requirement or drug requirement when that person has been found to have diabetes. Let's take for example, I told you that there is sugar in the blood, right? And insulin is required to take those sugar into the cell for usage. That is on the normal. But when somebody starts exercising, the muscle can take up the sugar even without insulin. So in the face of exercise, the insulin requirement and also the drug requirement for diabetes reduces. So before you start treating somebody with drugs, sometimes you try to use exercise. Exercise properly. Anywhere you can trek to, don't enter keke. I didn't say you should overwork yourself. Then that's just that. Again, but there are some misconceptions people have about this diabetes. There is no food called the diabetic diet. When any rice, go rice and the diabetes. There is no diabetic tea. There is no diabetic yam. Somebody will say, let me eat white yam on candy diabetes. It's not true. The same food that the diabetic person eats, that is the same food that the non-diabetic person will eat. No difference. In one of special diabetes rice, there is no diabetic tea. In one of anything special for diabetes, no. There is no time you will leave apple and you will go and start eating dawa or wheat that can bugo sugar. It doesn't work that way. Now, what we advocate in diabetes is the quantity. Now, if you know when you are not diabetic, that you can finish apple 200. The idea is, kita emego diagnosis of the diabetes, eat half of it, then take enough vegetable or more soup and meat. The only thing that changes is the composition of the food. In a non-diabetic person, you can take apple 200, but in that diabetic person, what we are going to do is that we will have the apple or garri as the case may be, then take enough vegetable and soup.